College of Pharmacy. I welcome Dr. Ganachari, Professor and Head of the Department Pharmacy Practice, Kelly University, Belgavi. And thanks a lot, sir, for accepting our invitation and addressing our students. Now, you can understand our anxiety as ours is the first college under University of Pune to introduce this course. And so the first batch is going to 5th year, as I've talked with you on telephone. So we are eager to hear from you and learn from your address, sir. Welcome once again.
Yeah, thank you, ma'am. First of all, I would like to congratulate the entire team who have made a tireless efforts to put all the things together. It's not a joke, organizing everything and all those things is always my privilege to be associated with your institution. And nothing to worry, ma'am, nothing like anxiety or anything else. Certainly, we all together can do good for a profession. It's not whether you are in Pune or Mumbai or Belgaum or anything else. Profession remains first priority. We all together can do the best of the best. I thank everyone who made an efforts and all those things. And thanks for inviting me to speak for the 5th year students. And I know that even students are equally anxious to understand aage kya hoga. It's the biggest question everybody asks to me. Probably I should able to answer a couple of questions. And if some students are listening to me or the audience are listening to me, please ask more and more questions. Let us be interactive. Okay, and I asked little more than an hour time from the organizers. They were good enough, but I'm allowed to. I spared little more time for myself also, so that any simplest of simple or any silly question, please ask us, so that at least we'll come to know what is there in your mind, or we'll try to clarify your doubts, and we can march ahead. This is a request for all the audience who have been participating into this. Even teachers, whoever is there, let us be more and more interactive.
Thank you, sir.
Thank you, sir. And a very good afternoon to one and all present here. It gives me immense pleasure to introduce Dr. M.S. Ganachari, a reputed persona in the field of pharmacy. He's accomplished his B.Pharm degree in 1990 from Gulbarga University, and then M.Pharm and PhD in pharmacology from KLE University. He has totally 28 years of teaching experience, of which 25 years are accounted for postgraduate level. He is a recipient of Best Teacher Award conferred upon him by KLE University, Belgaum in 2010. He also has to his credit Best Paper Award conferred by ATTI. He has published 52 papers in international and national journals, amongst which landmark publications include Lancet, which has an impact factor of 59.1, European Journal of Clinical Pharmacy, Journal of Oncology Pharmacy Practice, etc. He's been serving as a reviewer for American Journal of Health Systems. He has presented 21 papers in international and national conferences and delivered more than 100 guest lectures as a resource person. He has guided more than 63 M.Pharm students and 7 PhD students. His current designation is Deputy Registrar, KLE University, Belgaum, and Professor and Head of Department of Clinical Pharmacy, KLES's Dr. Prabhakar Kore Hospital and MRS, Belgaum. He is a member secretary of KLE University Ethics Committee and member of Institution Animal Dissection Committee of JNMC, Belgaum. He is also recognized as a research pharmacist, KLE Research Unit, in collaboration with NIH and Gates Foundation Global Network for Women's and Children's Health Research and NICHD USA for Phase 3 clinical trials of mesoprostol. Presently, Dr. Ganachari is a member of Expert Committee PharmD course constituted by PCI, Advisory for Editorial Board Indian Journal of Pharmacy Practice, and coordinator of MCI Inspection Committee. At KLE University, Dr. Ganachari has been working as a convener for 2 PG diploma courses, one in clinical research and the other one in nanomedicine. Also, he works as a secretary of Institute of Clinical Research Site Management Office. Dr. Ganachari's array of international accomplishment include his participation in different meetings and symposia held at Philadelphia, Cape Town, Argentina, Bangkok, Sri Lanka, Malaysia, and hands-on training at Drug Information Center, Austin Medical Center, Melbourne. He has also undergone training in the Department of Pharmacy Practice, Medical Center, University of Illinois, Chicago, USA in 2001, ICH and GCP training by CEFMER Sciences, USA. In addition to this, he is a life member of APTI, Indian Pharmacological Society, APPI. He was a president of IPA local branch, Belgavi. Dr. Ganachari is well versed with basic as well as advanced software programs used for research purpose like Micromedics, PubMed, Medline, etc., and various pharmacovigilance tools. Also, he is well acquainted with ICH GCP guidelines and Schedule Y requirements, various phases of clinical trials, design of clinical trials, and pharmacovigilance activities. He's been playing a key role in internationally funded and Indian pharma industry CRO-sponsored clinical trials as clinical research coordinator and different aspects of pharmacovigilance studies like ADR monitoring and reporting, causality assessment, etc. With this introduction, I would like to hand over the session to Dr. Ganachari, sir, for delivering a talk on experience to get experience through professional training, Crux for Pharm. Sir, over to you.
Yeah, thank you, ma'am, for very nice introducing me. It is my privilege, and it was really good to listen. Formally, I would like to start my my session. Again, I would like to thank all the organizers who have made many efforts and inviting me for this wonderful session. And always, I'm equally excited to understand that all the participants are the PharmD students. Dear students, I would like to appreciate your concern and your participating in this. I'm sure next 1 hour, a little more than 1 hour, you'll be taken through the journey of why, what, how, and all those things. I request the organizers, please keep your microphone on so that in between you can communicate to me if there is any technical glitches. So I should come to know whether my audio is clear or not, my slides are clear or not. Is that okay, ma'am?
All good, sir.
Okay, thank you. Just on lighter side, you have seen my one of the cartoon. It's from open source, which I put it. Which we say that I'll elaborate on this little later on. Saying that whether the internship should be paid full-time or unpaid or anything else. But when we discussion what we thought like, the talk will be experience the experiences. Always the students have got a lot of questions saying that, Arey, I joined PharmD, aage kya hoga? Right, it's a 6-year-long programs. We have got varieties of training programs and all those things. Friends, I'd like to tell you one thing. Always it's a very old saying is there, whether it's a chicken first or an egg first. I'll complete my degree. I'll go to the interview. Interviewer पूछता है कि अरे यार experience है क्या? Student will tell, sir, you give me opportunity, I'll get an experience. The interviewer says that, hey, you get first experience, then I'll give you the job. How to break this crux, or how to break this saying that, yes, I have got experience, give me the job. To keep all those things, Pharmacy Council of India has done a wonderful job. They're put together in such a way that the student will get all those things before he completes his graduation or a PharmD program. If you revisit your syllabus of the PharmD programs, in a 4th year, they reduce the number of subjects only for, in the 5th year, they reduce the subject only to 3. You are expected to do the clerkship. Then you're supposed to do the project. Then go to the 6th year, then you're supposed to do the internship. Many parents, many students try to understand or try to question us saying that, sir, what is the difference between clerkships and internship? So what is all those things? My next objective is to talk to you and tell that what are we supposed to do it? What is the significance of clerkship, the projects and internship? How it is going to help you to design or how is it going to frame your future career. So all those things I'm going to speak to you, all those people. As ma'am was telling that this is the first batch is coming. Unfortunately, this COVID has stopped all those things. Nevertheless, doesn't matter. It doesn't remain the same. The future upcoming days will be bright. Whenever things are there, we'll try to address your any personal or individual concerns are there as per the training is concerned. That's the reason we have taken up this topic as an experience the experiences. So always, when you're in the studentship, you should have to get the experience before you go for an interview or before you go for any of the jobs or anything else. So all the students, we commonly hear the words which are very common or anything else. We are interchanging the words. Internship, clerkship, housemanship, residency, fellow, so many things we have tried to hear it. Until and unless we appreciate the difference of in all these terminologies, we don't we'll be not very serious about why am I doing clerkship? Why am I supposed to do the projects? Why am I supposed to do the internship for 12 long days, 12 long months, 365 days? So these are all the big questions are there in the PharmD students. And specifically when the students I've seen across the country, I was lucky enough to travel across and majority of the institutions I've visited, and whenever I go and talk to the students, right? The student says that, 365 days, what you're supposed to do it. Sir, why they're given 365 days? So all these questions I'm trying to answer in my upcoming presentations and make clear saying that how serious are you supposed to do when you're doing the clerkship? How legitimately you should think or visualize your career through doing the clerkship and transcribing your thoughts into the projects what have been assigned for you, and take all 5-year-long experiences, your knowledge, your thoughts to put into the practice what we call as an internship, right? If you just make a note and understand saying that what is the difference for all those things. Just for example, like we are supposed to do the internship in the 6th year. What does it mean? It is simple. It is a position of a student or a trainee. He works in a hospital. Many times with the pay, without the pay, we'll not talk about the salary part of this. Why we work? To gain your work experience or satisfy requirement of qualification. As far as PharmD is concerned, yes, both. It is a mandatory requirement to get your degree. You should have to work. Second, you should have to gain an experience. That's the reason experience to experience. That's the reason we put a title saying that first you experience to get an experience certificate. And with this experience certificate, if you go for a job or anything else, they should not be the lighter side, the joke of the day. Get me the experience, I'll give a job. You give the job, I'll give the experience. Apart from those things, so internship is nothing but working for a hospital or organization with set of prime goals and objectives to gain experience and fulfill the requirement of regulatory requirements. Then what next? We have used different terminologies. In 5th year, you do the clerkship. In medical education, or else if you generalize it in a healthcare education or healthcare sciences, a clerkship, or else it is also called as a rotation, which refers to the practice in any of the department of health sciences, where it gives the students experience in the all parts of the hospital setting. That's the reason council what has done. You're supposed to put 6 months in medicine, then gynecology, orthopedics, skin. You should have to get rotated into the different departments and to get an experiences. Learning by viewing. What is the difference between internship? Internship, you are going to start practicing, of course, with the preceptors or the peer or the guide. In the clerkship, you are going to learn by viewing, learn by doing, learn by observing. That is the whole idea about the clerkship. That's the reason you'll be spending more and more time in the wards and try to understand how the clinician is doing or how the doctors are doing, how a practicing pharmacist is doing. You're going to learn by observing. That is called as the clerkship. The difference between internship, having knowledge from clerkship, you are going to work for in a hospital and try to understand what is happening. Here you are going to learn by observing, learn by viewing. Then we use a word calling as a training. We use commonly this for a B.Pharm graduates. We say that you are supposed to do industrial training. Then what is the difference between clerkship, internship and the training? It's simple. Training is nothing but action of teaching a person or any particular things by a type of a behavior. We are going to train the people, right? You can say that you are going to train the people means what? In clerkship, you are going to see and learn. In an internship, you are going to practice. In a training, we are going to train the skill and the behavior of a person. We'll say that how to handle the machine, what to do for the machine, what you are supposed to do it, what should be a behavior. All those things has got structured guidelines where you're going to train them with certain objectives. So that is the difference between internship, clerkships and training. Then you say, fine sir, internship ho gaya, clerkship ho gaya, training ho gaya. Then what happens is people use as a housemanship. So housemanship means what? Usually it is a houseman, or they call it as a junior doctors, where they've been trained in a hospital, usually post after the graduation. So what is this? Usually it is understood to mean the first 2 years of the training in the health systems. Usually it is called in the British systems of health, where the postgraduate students were supposed to do the housemanship. If you look for a dictionary meaning of housemanship means what? They are supposed to be housed. You should be within the department. You are supposed to be within the hospital to undergo certain training. Along with the training, gain some responsibilities, and after the responsibilities, you are supposed to render certain services. That is called as a housemanship. So that is the reason usually after the medical graduates are there, when they complete their internship and all those things, they appoint them as a house surgeons or housemen. Usually all these people will be having the services, or they're having the duty of 10 hours, 12 hours or 16 hours duties they'll be doing as a part of housemanship. Right? They'll be always the post in the emergency, they'll be post in the operation theaters, in the wards. They'll be housed there, taking care of all spheres of the nursing care, patient care, everything they'll be taking. That is the beauty of the housemanship. Then we'll hear the word of the stewardship, right? The stewardship, we have commonly in pharmacy practice or the PharmD students, we call as an antibiotic steward. Right, in your Western countries and all those things, they are called it as I'm an antibiotic steward. So what is mean by the stewardship? It is a job of supervising or take care of something such as an organization, property, or some of the activities. Commonly, on the lighter side, where we see the stewards we see in the restaurants, in a bar and restaurants, where there will be steward will be there. What is his job? He is going to try to take care of all the customers, right? In such a way that it is functioning, he is going to supervise whether it's functioning as per the standard SOPs, standard guidelines or not. Similarly, stewardship is nothing but if I'm a steward of the antibiotic steward, if I'm an antibiotic steward, I'm going to take care of all antibiotics prescribed in that hospital. Are there as per the standard treatment guidelines? Are there been prescribed as per the SOPs? Are there any of the adverse drug reactions? It is a job of a stewardship. There is another term we use very commonly is the stewardship. Then we have got a lot of other terminologies. Sir, that's all happened. Then what we call as an apprenticeship. So what is this apprenticeship? Apprenticeship is nothing but usually it is used for an engineering people and all those things, where the trainee is going to learn the craft or a trade or an hands-on experience while working with the skilled labor. Especially if a doctor is, if the medical graduate is going to work with a surgeon, right? That can be called as an apprenticeship, where you're going to work with the skilled labor as an assistant, as a supporter, and try to learn while observing, by assisting, by guiding him. That is called as an apprenticeship. Usually it is done with a written or implemented internship agreements, where you got an agreement for all those things, where he's going to work. Usually surgeons, if they want to learn some surgeries and all those things, they can pick up it as an apprenticeship, learn the skill while work. Along with the work, you can learn the skill and then get a certificate that helps you for your jobs and all those things. Coming back to my earlier example, antibiotic stewardship. In your 5th year or in the 6th year, out of curiosity, over and above your curriculum, of your interest and enthusiasm, some student want to do some structured stewardship of antibiotics. Talk to your teachers. You work in a department. Suppose if you're working for geriatric department, as an project, as an enthusiastic person, you can say that in 3 months, I want to do the antibiotic stewardship. Monitor it, get a certification from a doctor or the physician or head of the department, your teacher. That becomes an experience certificate saying that, yes, I've got the experience of working as an antibiotic stewardship. Friends, I'd like to tell you 365 days as an intern and 180 days as a clerkship is a big time for your life to design, to shape your career. Many a time I've seen the students, once they finish fourth year, they think they are top of the world. Sorry to say this, with my experience, I'm telling, once the attitude of a PharmD students changes, I think my teachers on this session will appreciate. Later on, we'll take up a question and answer session. They think something, yes, I have done everything, I achieved anything, nothing wrong in pursuing that. But friends, actually your life starts in the 5th year and 6th year. Take these 2 years very seriously. Take these 2 years very seriously and see this at the end of the 6th year, either you should have to get either one of these certification, which should be close to your heart, close to your mind, you should be pretty confident. And once you have done it, I'm sure that the common question they ask is, Aage kya hoga? You know, there's nothing like everything is possible once you are serious about all these activities, right? The next terminologies we use in the health sciences or in medical education is the residency, right? I want to become a resident. There's slight difference between the residency and a houseman. I said houseman is also going to get placed. He's going to work beyond 8 hours. Of course, he'll have a lot of other facilities and all those things. But in a resident, what happens is usually a physician or a qualified PharmD people who joins a medical staff or a hospital as a salaried employee for a specified period to gain an advanced training, right? Again, there is small overlap between the residentship and a fellowship. Okay, I'll come back to you a little later on of the fellowship. Here you are going to get a salary with the condition saying that to get an advanced training programs, usually in a particular field. For example, if you want to get a trained in the clinical trials or clinical research, right? After the graduation, you can ask for a residentship. You can look for a residentship. I'm sure after 6 years, you can't afford working free of cost. Already have spent enough time and money. In such cases, many institutions give the residency means what? It is a win-win situation. They pay you, but pay will be not very high. They give some stipend or they give some money which can sustain your day-to-day bread and butter. But what is the objective for you? To get an advanced training in specified period. That is called as a residencyship. That is called as a resident. Having said resident, friends or a student is not like 9 to 5 job. If you look for a Gurukul systems in the old days, recently in the lockdown time, I think thoroughly we enjoyed Ramayana and Mahabharata. What happened? They used to leave all their luxuries. They used to leave their palaces and they used to go to the forest where the Guru used to stay there, stay in the way how he stays, eat there. And what they used to do? They used to learn the skills. Similarly here, it is not 9 to 5 job when you do the residency or a fellowship or housemanship. You should have to dedicate yourself entire your time because there is a crucial period to learn the thing. That is called as a residencyship. Student may put up a question saying that, sir, is it possible in our country? Friends, yes, certainly yes. But ball is in your court. You should search extensively across the hospitals, across the institutions, and you should have to learn to express your interest. Until you express interest, how can I come to know what you require? What are your areas of interest? Right from the 4th year onwards, you should start designing what should I want to become after 5th year or 6th year. Commonly when I ask my students, क्या बोलता है सर पहले डिग्री तो खत्म होने दो बाद में देखा जाएगा. No, it's not like that. You should be very clear, very confident, very concurrent saying that after 6th year, what I'm supposed to do it. For that, what are the training I'm supposed to do with it? To gain all those things, we are supposed to, we are supposed to look into the other components of the training, other components of all those things. That's the reason I'm trying to explain you what do you mean by internship, what do you mean by scholar, the resident, houseman, and all have got a different meaning. And all the things are quite possible to do it, and it is available. And everything comes with a value for a money. quickly before I forget it, usually in our pharmacy profession, what has happened, we get shy to ask the questions, first thing, right? Second thing, what happens is we have got a lot of both inferiority as well as superiority complex, right? Why should I ask a silly question? Or else, right? The other thing, superiority is, it is very simple. It is nothing like superior or inferior. Friends, you should be open to ask the questions, open to learn. Many times I see the students after B Pharm or after M Pharm or after Pharm D, they saying as if they've done a big thing. Enough is enough, sir. हो गया मेरे को job चाहिए और बीवी चाहिए. There's only two goals. I want a job and I want a wife. It's not like that. We are lifelong learners, right? We should keep on learning and spare some part of our revenue or income and some part of our time to learn. I'll give you classical examples. Usually in the hospitals, when the students goes for rounds and all those things, they will only looking into a cardiac surgeon moving in the swanky BMW or Mercedes Benz car, and you will always we say that, "Arey yaar, kitna laki hai wo Mercedes Benz mein ja raha hai." Have you seen his timings? My cardiac surgeon in my hospital, he starts a day at morning 6 o'clock. Believe me, he enters into the hospital at 6 o'clock. He does the pre-rounds. He interacts with all the hospital staff and OT staff. He starts a surgery at 7 o'clock. He ends up surgery at 12 o'clock. After 12 o'clock, he do the post rounds till 1 o'clock. Still 1 to 2, he has his quick OPDs. 2 to 2:30, half an hour he'll have a lunch. 3 o'clock he join the teaching, then OPD, then grand round. Then he ends up the day at somewhere at 11 o'clock. Can you imagine? Morning 6 to 11. Introspect yourself, how much time you spent in 4th year, how much time you spent in third year, right? It's an open question. If you're serious about all those things, you can also move in a Mercedes Benz. Nobody can stop you. Until as you stop, if you start craving to learn more, right? Then certainly things are possible. I'll give an example. A person does a surgery. He's not happy with surgery. What he does, he wants to do a spine surgeon. He tried to go and become a resident in a spine surgeon. He learns spine surgery. I'm telling all post-MS. He's not happy with the spine surgery. What he does, he wants to do the minimal excision surgery. He's not happy. The same surgeon goes to say that after minimal excision surgery, he wants to become super specialty. He was quoting, okay, only lumbar, the spine at L1 and 2, L3 I'm going to work. He'll narrow down his expertise. He's not happy. He wants to go for a robotic surgery, right? So all this, how he does it, because he's craving to learn more and more. He wants to become updated. Friends, believe me, all those things are not free of cost. I know many of my friends in my medical college over here, they go to the remotest of the remote place, they identify. For example, when that minimal excision surgery started, right, there's only one surgeon in CMC Vellore. One of my friend, he waited to get an appointment of that person at CMC Vellore for more than a year. After a year and a half, he got an appointment with the surgeon, right? Then he volunteered himself, went to CMC Vellore, and he became a resident. He got a very less salary, but he worked for nearly 1 year to gain that knowledge about the minimum excision surgery. He came back. Now he's one of the best surgeons in this part of the country. And of course, he moves in the best of the best car and all. Moral of the story is that after Pharm D, don't get tired. Don't become lethargic, right? Spare some time, spare some money, enrich your knowledge, then sky's the limit for you. That is about the residentship. Then again, as I said, fellow is nothing but it is a friendly association, especially with the people who shares one's interest. I'm sure you all appreciate the difference between the residentship and the fellowships, right? Here also, what happens is these fellowships are very small. There may be 1 week, 10 days, 15 days, 1 month, 2 months. It is a very dependent upon the differentiations. They'll have the fellowships on the focused areas, right? They can join as a fellow. As we commonly call it, it is a friendly association with the professional people. Here also to share one's interest. Is that clear? That is called as a fellowship. People may be amazing. Sir, क्या बोल रहे हैं आप? बोलते जा रहे हैं, where you are going to end up? It's not like that. we call as a mentorship. Again, in Pharm we use the mentor, right? Very delicately and very thought-provoking. Pharmacy Council of India, President of Pharmacy Council of India has put up all these terminologies in Pharm D. Many people will say, surprising, clerkship is same way, internship is same way, project is same way. No, it's not like that. That's what I'm trying to clarify. What is mentorship then? Mentorship is nothing but guidance provided by a mentor, especially an experienced person in the company or an educational institution, for a period of time during which a person receives guidance from a mentor. Suppose if you have been working in oncology world, a guided person can become a mentor. When you say mentor, not necessarily onco-physician, onco-surgeon, no. Simple, even a nurse can become a mentor for you. Even a ward boy can become a mentor for you. A brother in the hospital can become a mentor. Any experienced person working with him, he can become a mentor. Right? You rethink all this terminology and say that who could be my mentor? Mentor can not be one person. It can be more than one person. Simple definition of mentor is a person who is going to share an experience with you. Your senior students can become a mentor for you. Right? You should have to work on all these terminologies to become a perfect pharmacist or a perfect Pharm D graduates. I got a long list. Don't get bored with me. Right? These are all relevant. These are very, very important for all of you. Observership. Usually in health sciences, observership is an experience while individuals with or without prior education can observe some professionals as they care the patients, families, all those things. Simple, just before starting this webinar, ma'am was asking me, sir, I want to visit your institution. Fine. Then what category you come? You become an observer. You come for a day, stay with me, see what all I'm doing it, how I'll start a day, how I'll end up my day. That becomes an observership. You are going to learn by observing the systems. Here you're not going to do any rocket science, but you're going. This is also very, very important because in our Indian systems of learning or in adult learning or anything else, we learn by observing, right? Observation makes a lot of person very perfect. We love to do those things. You can take simple from the fashion, right? How do you love to learn to what type of shirt I should wear, what type of tie I should put, whatever things are by seeing. If I see some person wearing a yellow tie, I get, acha dikh raha hai. Why can't I try it? Same thing in profession. You should work from the observership. Somebody is practicing good. Why should I not do it? Don't stop there. If you like it, practice it immediately. If you like it, implement it immediately. Right? That should be an attitude of a person. That should be the observing capacity should be there, and that is called as an observership. All those things are very, very important for a professional, for an individual, especially for the students of the partners, for the Pharm D students. Another thing we use, externship, or else experiential learning. Right? These are all the opportunities similar to the internship, provided with the partnership with the educational institution, employers, where students get a practical exposure in the field of studies, which are external or experiential learning. I may not have all facility in my hospital, right? Don't compare. But still, world is big for you. Every hospital can't have the similar facilities. Nothing wrong. It's not, world is different. But you can tie up yourself, you can partner yourself with the institution of your interest, go as an external student, gather the grab the experiential learning, do the trainings, and then you are going to get it as what you call as an externship or experiential learning, or they're similar to that of the internship. Same thing, experiential learning is a process of learning through experience, is more specified, learning through reflections on doing. This is precisely what I'm trying to do is here to trail, that is a total experience with experience, right? For experiential learning, where you are going to work, do exactly what you want, along with the peer, along with the mentor, to get the experiential learning that becomes more and more scenarios where you can get the lot of fruits or lot of experiences. So these are some of the background of my things, why the student should do all these activities is when you come into the 5th year and 6th year. Can I have the organizers, my audio and videos clear?
Yes, sir. Yes, sir. Yes, sir. Yes, sir.
Okay, thank you. Thank you. Thank you. Now the question comes, why should I do 365 days? Sir, I have done 5 years. 4 साल हो गए, 5 साल में I have done the clerkship, project हो गया. अरे why PCI ने पागल है क्या? Why they put 1 year internship? That to 365 days. Friends, it is not like that. 365 days used to get an experience certificate for you before you go for an interview, before you search a job, before you hunt a job. You should get a categorical, well-defined, confident certificate with you. Then it becomes chicken first, egg first. You go to the interviewer, say that I got an experience certificate, give me a job. I'm sure who will not say no to you. But you should understand what are you going to do during the internship. I said I'd give all examples, and wherever is there, you should have to pick up and document it properly, understand properly. Then the meaning of 5th year and 6th year makes more and more sense for you and more meaning for you. First and foremost thing for an internship is called as you'll get a real world experience. What is that? Real world experience. Simple, I'll tell you. When you started first driving a vehicle, 2-wheeler or 4-wheeler, when you sit from outside, both things happens. अरे उसमें क्या है? स्टीयरिंग पकड़ने का, गियर डालने का, चल रहने का. That is one thing. Or as other part of a story is also, it is very difficult. How should I negotiate? इतना traffic आ रहा है, कोई horn बजा रहा है. But what happens is before you actually venture into this, all these questions will be there. Once you start driving, it is very easy. There's no problem. Same thing happens is when you start doing all those things, internship gives a real world experiences. Usually I'll ask the question to my students is, or if you introspect yourself, who all are the audience over here, you just close your eyes and look back. What was your goal when you were in primary school? What was your goal when you came to the high school? What is the goal when you come to the college? What are your goal when you're doing Pharm? It keeps on changing. You go back and ask your father or mother, grandfather or grandmother, when I was very small kid, what I was supposed to do? Kya banna chahta hai? Invariably, children will say that I want to become a driver, auto driver. Ask a girl, she want to become a air hostess. So these are all funny sides. It keeps on changing. But here also what happens is, PharmD have got so many dreams, they have got so many opportunities, but to realize all those things, you should be very, very serious for your internship because it is a real world experiences. For example, one student says that I want to work in a pediatrics, my passion hai, wo hai. Then we ask the question, why you want to work in pediatrics? No, sir, I love kids. Right? If you love kids, that doesn't mean you want to become pediatric pharmacist. But here you got an opportunity is where you say that you are going to get a real world. When you posted in pediatrics, after 1 day, 2 days, person get fading up. They're getting a lot of things. I'm not comfortable with this thing. Means you're going to try or test your interest hypothesis in a real world, whether it suits to me or not. That is called as a real world experiences. Whether, in other words, it is participating in the internship allows the interns to get a perspective on potential employments once they are done studying. Means what? It helps you to transit from the classroom, what you learned in the classroom into exposure and smoother transition from interns from classroom to the workstations, from the classroom to the hospital, classroom to the wards, classroom to the unit dosage formulations. Where you get a real world experiences for 1 year, you can test it, you can try it. If you love it, explore into that. If you love it, excel into those things. If you love it, start learning more into those things. That is a specialty of the internship. That is called as a real world experiences. The first primary goal, first primary objective of the internship. It is a personal development. It helps you to develop, including building up a soft skills, such as personal work ethics, interpersonal skills, Also technically hard skills like execution, refining, analytical cap. So all these things you will get an opportunity to work when you're doing the internship, right? You are independent. Many times in 5th, 6th year students, they think, "Arey yaar, mera PharmD ho gaya, 6th year mein kaun puchne wala hai," right? Nobody's question. There's no timetable. There is just attendance. Koi puchne wala nahi hai. I'm on my own. No, it is not like that, right? It is a self-directed learning. It is left to you how best you want to take advantage of this 1 year of internship or 6 months of clerkship or 6 months of your project work, right? So here you are going to work with a physician, you are going to work with a phlebotomist, work with a dietitian, work with a nurse, sorry, the patient attendants. So many things are there. It helps you if you work there, not 8 hours, not less than 10 hours in the hospital. Friends, believe me, it helps you to understand all those things. Another importance of internship is to develop the networking. It helps you to understand and try to build a networking with the other colleagues. Share your knowledge, validate your knowledge, that it could be used to the contact of the future references for work-related advices. You'll get an opportunity if you're placed in cardiology department, you'll get opportunity to talk to the cardiac surgeon, express your strengths, express your wish. I never mean that हर आदमी को मिलता है सर मेरे को जॉब देगा क्या? No, that's not the meaning of my word. It is an opportunity to network, an opportunity to share your strengths, share your skills, demonstrate your skills. That is another goal of an internship. As I gave an example of pediatrics, पहला pediatrics अच्छा लगता है. When you start working in pediatrics, क्या होता है? No, I can't hear the baby crying, peeing over there. You know, so many. No, I'm not interested. Fine. This is called as a testing field. You got a choice. Decision about your quite prophylaxis more than so that one cannot discover what one really wants to do it. So here what happens is exposure beyond our formal learning can go a long way resolving such an earlier age dilemmas. As I said, even I can say that my kids or myself, when I was a small kid, I wanted to become an auto driver. Chalte, I wanted to become a firefighter. Started my schooling mein bus kya ho gaya, then I was only busy with playing cricket, right? I wanted to become like a Sachin Tendulkar. When I joined for Pharm, right? Then I started thinking I want to become like Ambani's or something like Reddy's, right? Things hote jata hai, but we'll forget to say that what is going to happen with me? In internship, you got a choice. You got an opportunity to test my hypothesis. I want to become a psychiatric pharmacist. चलो ठीक है, psychiatry में जाके काम करेंगे. Does it suit to my requirement, my capacity, my knowledge? If yes, you can pick up that particular job or anything else. And during internship, the intern demonstrated that they were able to enhance success of the organization. Employer feel that selected intern will prove themselves as an asset for an organization. And if you see that, if the Department of Cardiology feels that it is worth, you'll get a job or they can recommend you, right? These are all the opportunities you try to get it during your internship, right? Now, I said that why all those things are there and all those things. And apart from those things, I try to clarify what is internship, all those things. Then I said why you're supposed to do the internship. And quickly, I'm going to do with the do's and don'ts. Is that okay, sir, till now?
Yes, sir.
Yes, sir, absolutely fine.
Yes, thank you. Yeah, because this is the beauty of webinars. It's not become like a TV serial. हम बोलते जाते हैं. At the end, we should not get lost. Right.
No, it's all good.
Thank you.
Fantastic.
Thank you. Friends, I'm going to talk what are the do's and don'ts during your internship. Specifically in my talk, I made clear saying I'm not going to teach you therapeutics or anything else. I'm going to take some basic funda for you to become a successful pharmacist in your life. I'm sure all of you appreciated what do you mean housemanship, internship, residency, and so on and so forth. I also clarified that what do you mean by internship. Now I'm going to tell something called as what do you mean by what are the do's and don'ts into your internship. Because this is very, very important, etiquities of your life. Because all those things are not covered in your syllabus. And all my teachers doesn't have so much time to tell all those things, because you should have the basic qualities in your life to understand all those things. I'm going to talk for next couple of slides, very, very important, very, very relevant to become a successful pharmacist, which help you to get a job, to polish yourself, to manage yourself, or to supervise yourself to become a more successful professional in your life. Some of the do's and don'ts, I'm sure you'll enjoy these things, right? During an internship program, students the interns must remember that they are the representatives of the reputed institutions and carry themselves in the manner suitable to their values. You are an ambassador of your pharmacy college working at your hospital. Please remember it. All institutes expect the students to maintain very high class executive and ethical standards. And institutions expect the students should keep up the standards of his or her place of work. You've done your PharmD in a college, you got your own hospital, or you got a tie-up hospital. You are migrating from this educational or academic environment into a clinical environment. You're going as an ambassador there. You should have to mind it. You're taking the flag of your college. Right? You should be very careful when you do this, because you are going to go to and you are going to try to get adopted or accustomed with the terms and conditions of that hospital. You should respect them, right? Whatever the rules and regulations are, this is the first things you are supposed to do's and don'ts when you start doing the clerkship or when you start doing the internship. Predominantly, it is vital to be very important. You should be regular. More or less from 5th year onwards, your monitoring will reduce from your teachers. As I said, you are a self-directed learner. कोई पूछने वाला नहीं है, देखने वाला नहीं है. I can come at 10 o'clock, I can come at 11 o'clock. If this is attitude, you will be utter failure in your life. I don't have opportunity to ask the questions or back and forth here, but you can introspect. There is a lot of difference between you are regular or you are a punctual. Ask yourself, am I a regular student? Am I a punctual student? If you differentiate between you are regular and punctual, then you will be one of the best pharmacists in your life. You should be obedient, right? You should be honest, sincere at work. If you want to imbibe all these qualities, right, you should have to start practicing it. You should have to start adopting it. Till 4th year, you are students. Now you are no more student. You are an intern. You are a resident. You are a fellow. Whatever the word suits, you can call them. To do all those things, you are regular, punctual, obedient, honest, and sincere. When you go for a campus interview and all those things, usually we hear, sir, वो मिडो वर्कर था, ordinary classmate था, उसको job मिल गया, मैं sincere था, मेरे को job नहीं मिला है. These common questions asked every time to me. If that is a scenario, put a comma to this question, ask yourself, उसमें क्या था वो जो मेरा में नहीं था? What was there in that particular student? He was a middle worker, he was not a first class student, but he was okay, chalta hai. फिर भी he got a job, why he couldn't get a job? You find out those things. Probably these are the things what he can demonstrate. Many times we may fail to demonstrate. This is an opportunity for you. It is a live laboratory given to you, opportunity to you. You should be regular. You should be punctual. You should be obedient. You should be honest. You should be sincere at work. Later on, you can ask me a question. I'll tell you how to demonstrate you are regular, how you are punctual during your internship. Unprofessional behavior like dishonesty, misconduct, indiscipline, irregularity at work, and unsatisfactory performance will tarnish the image of yourself first, then your institution where you've been deputed or whom you are representing. Right? These are very, very important for intern, for a person who is doing clerkship or person who is doing the any type of the residency program. No student is doing a favor to a company or hospital or pursuing his internship, right? So don't pose or show off. अरे यार मैंने fees दिया है, तो क्या किया? You are not done a favor. right? Don't show off over there. You're not going to make a fare by entering the hospital and doing the internship or a clerkship. No. It is your responsibility. It is your request. It is your requirement, right? That's the reason you're offered for internship. Don't blame principal. Don't blame HOD saying that, no. Our job is to make an opportunity for to do those things, right? Don't behave like as if you have done everything. चलो ठीक है, hospital में जा रहा हूँ, अच्छा apron डाल के घूम रहा हूँ, right? No, you are not going to make a favor for me or my department or my HOD or my principal. Intern should not be adamant and obstinate, but be humble in requesting for information or any data from a company. I see that when I post my students in my hospital, right? You can't say that I paid pharmacy में college में पैसा दिया हूँ, मेरे को you give me this, you give me that. No, never. Clerkship and internship, 5th and 6th year, it teaches a lot of lessons in your life. You should be humble. You should be compassionate. You should be passionate, right? Please don't do all those things when you're doing the internship or clerkship, especially in 5th year and 6th year. Another thing, student intern should never misuse the resources of the hospital. Of course, telephone, thanks to Jio, now there is no value for telephone. Down the line, 10 years, 15 years back, making a phone call was a passion. If you got a telephone, fax, internet, don't misuse them. Photocopy machine, so photocopying machines. चलो जेरोक्स मशीन है डिपार्टमेंट में, मेरा थीसिस है, रात 6 बजे शाम पे आ जाओ, फोटोकॉपी करके लेके जाओ. No, many of the corporate hospitals having a coffee machine free of cost. Don't misuse it. It is the only person when it become a fatigue or lethargic or tired होने के बाद you can go and grab one cup of coffee. Don't make it as a place where you can pull a chair, call some people, go on enjoying the free coffee, and don't the misuse of those things. Vehicles of a hospital, don't misuse of all those things. Nothing is free in the country. It costs as much money for the company as for the interns. Don't misuse all those things. Quickly, I would like to share one of little examples. In those days, 10 years back, I was having a telephone line with having the ISD line in my clinical trial because I used to get a lot of ISD facts and all those things, right? Students could have picked up and called and done international calls or national calls. Believe me, in my experience, I should congratulate all my past students and my colleagues. Not a single person misused those things. It can be well reflected. So what is the moral of the story? Please don't misuse the facilities. Well, there is another, just I'm sure I'm talking a little more than 45 minutes now. A cartoon is self-explanatory. I'll just read. Good luck, and remember, it is never an unpaid internship. If you steal enough office supplies like paper, pen, fax, and all those things, is reminding you nothing comes free. Be very humble, be very disciplined in your, because people will be monitoring, people will be observing your attitude, your concept, and all those things. Student interns should not get into the cabins of a managers, of a consultants, HODs. These are etiquettes you should learn. Nobody are free. They're all busy. Right? This not only will disturb but also deviates them from their work. You should have to have etiquettes. If you want to talk to a nurse, if you want to talk to a physician, please make a habit. Sir, can I talk to you, and what is a good time for you? Initially, thoda show off lagta hai, but you should have to practice it. Right? That is called as an etiquette. If you want to talk to a psychiatrist or anything else during the round, so you can say, sir, I want to talk to you for how long? You should make sure. Sir, I want to talk to you 10 minutes. What is a good time for you? You can put a mail, you can text him, or you can personally ask him. That is the best way to talk. You can't just, because of a student, the posted is not the responsibility of the principal or HOD. You can't just walk in anybody else. Never ever do those things. Never ever do those things, right? You should have to have those some etiquettes before entering any cabins of the physician or the interns or any house surgeons or anything else. You should have to have the proper appointment or proper request should be there. Student intern would not try to find out the pay scales, very important, curious, promotion criteria, HR policies, etc. Every company has got its own policies and certain things are there. होता है कभी कभी all the people have got it. When you get an opportunity, you are curious to know that. Right? I got one more talk and I'll be talking to many of those times of the students. First and foremost, the question behind any young graduate, first they think is, मेरे को पैसा कितना मिलने वाला है? Nothing wrong, curiosity होना चाहिए. But there is a wrong place to explore, spy, identify, saying that what is the salary, what is the promotion criteria? No, that is not an opportunity. When you are there interns, when you have been posted, please don't venture into asking all those things because many things are confidential. Student interns should not be curious to know everything in a short span. Enthusiasm is good, but curiosity kills the cat. Mind it. During internship programs, interns should not dress up shabbily. I know nowadays people try to live the bears. It has become fashion nowadays. All students want to live the good bears, right? When I started seeing my students, then I never lived this French bear. I also tried to देखिए क्या होने वाला है, इसलिए I started wearing the bears. But it should be well trimmed. It should look good, right? Just to share my student experience, everybody should leave the bears. I used to tell my students, अरे यार क्यों छोड़ रहे हैं? वो बोला sir, it is a trend nowadays. If you are not a beard, you are not a what do you call it? It doesn't suit. Then I thought, चलो ठीक है, मैं भी छोड़ दूंगा, देखूंगा क्या होता है. Then I also started doing it, but nothing wrong. It should be well dressed. It should be well trimmed. It should look good. Right? Dress according to the occasion. In a hospital, we have got all dimensions. Right? Beta Y, there will be celebration. They'll be in good mood in a hospital. They are deceased. They are in bad mood. We don't know. Dress accordingly. Formals for general duties, corporate attire for meeting, presentations, and casuals for parties and social. I need not teach all those things for my students. They're all good, but mind it. Right? I'm sorry, these are not my slides, right? Don't blame me, but just on lighter side, I'm going to read this slide. This is from the open source, right? Girl intern should not make up her with whatever things are there. Don't blame me or don't shout at me. Yes, this is a part of the some of the etiquettes are there. You are the best judge. You are supposed to take care of all those things. And during internship programs, student interns should not be wear very heavy gold, silver, diamond, right? And they should not impress others that their present availability, simplicity, and professionalism and pleasing personalities. Small things make a lot of differences because you are working in such an environment where we have got a lot of things are there. They require empathy. There are good things are there, bad things are there. किसी का पिताजी ने कैंसर हो गया, किसी ने मदर को कोच हो गया, बेटे को, see so many things are there. Our facial getup, our dress, our behavior makes a lot of sense. And during internship, because in 365 days you are going to be in the hospital, in the wards, all those things make a lot of sense. Student intern should not put up a dress very bright, dazzling pattern, designs, colors. You can do after your office hours. Never be late to your duties, training, meeting, and presentations, right? Be dot time. You might be seen where my time was given at 12 o'clock. I was there 10 minutes to 12. I logged in and I was ready, right? I'd taken all my appointments. I tell that I'm not available. Such type of preparedness should be for the simplest of simplest seminar, for your journal club, for meeting, for rounds. That shows my earlier slide said that are you disciplined? Are you obedient? Are you regular? Are you punctual? During internship program, interns used to the magical words like may we, could we, thank you, sorry, welcome, excuse, etc. for as per the situations. Of course, don't argue with your colleagues, seniors, bosses, or subordinates. Don't pull the courage to do all those things. Especially if you're working for a corporate hospital, especially working for a teaching hospital. See, you are also students. Now you should remember all those things. During internship program, internship should never criticize the rules and policies and cultures of the company, right? जाके उधर बोला है क्या हॉस्पिटल है यार, कुछ कॉफी नहीं मिलता है, चाय नहीं मिलता है. Don't venture all those things. Because you are a student, you are an intern, and interns should never ill-treat and misbehave with the administrative or menial staff. Interns should not miss a chance to perform and grab the corporate challenges. Right? Interns should never give a loose or cheap or weak and sick appearances or presence of impression of ours. It should not look savvy. I know many students will get rounds it at 9 o'clock. I'm sure he'll get up at 8:45, grab an apron. Apron itna untidy rehta hai. ठीक है? Then just rush and they drop into the wards. Don't do all those things. Never worn or thrown the unfriendly expression on your face. Smile doesn't cost anything else. Right? That doesn't mean I don't tell you to smile everywhere and anywhere. Have a pleasant face. Get up early, plan a day, go into the wards, go into the rounds. Interns should never should not exhibit our sense of humor unless we are tuned and expression around us. Interns should not be rigid. Adaptability is a desirable quality. Interns should not ignore the culture and belief of a hospital. Very, very important. Interns should not behave as if they have a lot of time to waste and prefer only pastime. This I see with the interns. Never do it. Never use the bad languages. Shouldn't discuss political and religious. Should never discuss politics, religion, sex when you're on duty. Interns should not misuse the freedom. Male interns should never misbehave with the women. Respect the women. Very, very important. Respect your fellow colleagues. Right? All those things are very, very important. Right, so I'll take another 5 minutes, sir. I'll wind up. Interns should not interfere with the unrelated, unnecessary issues. Interns should not spread and create rumors. During internship program, interns should not find out other faults. Take only a good and positive things for others and leave the rest. These are some of the qualities what we expect. Another thing, the intern should follow about the guidelines effectively, efficiently, then they can achieve the various skills such as adaptability, time management, networking, team building, management and communication skills, or else the presentation skills, whichever is useful into the future careers. You should be very serious. All the guidelines is what I've spoken to now. It helps you to make your life or design your career in the best of the best way. The another thing, a lot of students think that if you start practicing all those things what I've spoken till now, it becomes more and more meaningful, more and more fruitful for your career and all those things. I'm sure it is clear the definition till now. The do's and don'ts. I got another 5 slides or 6 slides. Till now, the audio and video is clear, sir?
Yes, sir.
Yes, sir. Yes.
Okay. Thank you. Fantastic. I'll just pull a couple of slides are there before I wind up. The students who are interested can raise your hand or put a question or write a question in front of you so that after my slides, we can start having the question answer sessions. This internship or training programs will help you to ability to work under stress. Very important. The days are gone, one man, one job, one person, one job, the concept has gone, right? Even in the internship or nowadays, what happens is we ask the teachers to do 101 things, right? This internship program or during the clerkship, it helps you to learn how to work under stress, right? HOD bolta rehta hai, you do take the class, you fill the forms, your accreditation ho raha hai, NAC ho raha hai. You should understand during all those things how to work under stress. And in the corporate world, multiple tasking, the world use the word multiple tasking. You should be tuned to work for a multiple tasking. Nowadays, it can't happen one person, one job, one at a time. No, it can't happen nowadays. So during internship and all those things, you have been asked, you have been get an opportunity to work under stress. And don't get scared. Stress means you don't think that future career mein sirf stress hi hoga. No, you can enjoy once you understand all those things. right? Always waiting, build a tolerance among the students. Have patience, right? Usually in Bollywood movies and all those things, Mera bari kab aayega, right? I'll get back to you. Sorry, and even one of the Bollywood movie, Apna time aayega, right? Bollywoods are very smart. Our Indian Bollywoods are very smart. They pick up the situation and they say that, apna time aayega. Friends, yes, sabka time aayega. You should have patience. You should learn. You should empower. You should build a confidence in these 2 years. Then the things happens the way how you visualize. A good platform to reflect on theories and concepts learned in the classroom, to observe and apply in the real life situations. It reinforces classroom learning through practices when you call about the internship or when you call it as a training. Back to basics. Another thing, before I forget, I'd like to tell you, when the students are in 5th year, 6th year, don't go back to your rooms, search for the books which are learned, which are studied. Very important for 5th year, 6th year student to revisit your DPRO. Look back your anatomy, physiology. Look back into biochemistry books. Just ek din mein you should have to read it. Try to correlate. If you are studying diabetes in the 4th year, 5th year, 6th year, don't think you know everything. Revisit to the basics. What is the etiology? What is the physiology? What is the pathophysiology of the diabetes? Learn, go back and revisit your pharmacology knowledge. Consolidate all those things. Come back to the wards. That becomes more and more meaningful. 5th year, 6th year is very important and very, very important in your stage of your life. Leads to self-discovery of your strengths and weaknesses while facing the challenges on the job. Right? When you're internship, you start assessing yourself. Do the SWOT analysis of yourself. What are my strengths? What are my weaknesses? What are the opportunities for me? Concentrate on those things. Start working on your strengths. Convert your weaknesses into opportunities. Convert your the thrust into the opportunities. Pull all those things. Try to build your own portfolios before you complete the graduation. Then sky's limit for you. Develop creative and innovative skills when you're students. Right? You should have to develop a creative, innovative thinkings. Can I do these things in a different way? Can I do these things in a more competitive way? Can I do in the more acceptable way? So all these things are available for you to try to and test you to when you are there in the ward rounds or when you are there in the clerkships or projects and anything else. Indicator of final placements and develop a leadership skills on the such other triads. All these things are indicators of your final placements. 5th year, 6th year are not waste of time. This is very, very important for you to design or to make your career. Don't get scared. I'm not scaring you. I repeatedly using the word learn to work under pressure. Don't think in other way. Right? Take an other side of the story means you should have to learn what is multitasking. Right? My students are working for my clinical trial. I'm running around 100 clinical trials in my hospital. Right? I ask the students, do the rounds, journal club karo, seminar karo, ADR karo. Then students should ask, sir, itna kaisa karu main? It's very simple. You should have to learn. If you plan a day meticulously, then you will enjoy the pressure. Pressure will not overshoot your activities. If you plan systematically, things can happen. You should be learning it is an order of the day for what we call as a multitasking. It is the order of the day. It is called as a multitasking. Right? Of course, you enjoy the global employment opportunities if you take up all these activities and all those things. Learn to work around the clock. Very important. When I was a student, when the very senior teachers used to come and talk like this, as a seminar workshop mein jab deta tha, you should call. See, I'm working 18 hours a day. As a mid-walker, last bench mein बैठ के हंसता था, ये बुढ़ा क्या बोल रहा, 18 घंटा थोड़ी काम करेगा. But if you ask me right now, friends, I'm working less than 16 hours a day, 14 hours a day. Things happens when I'm not exaggerating. When you get involved in those things, you should learn to work around the clock, right? Every time keep updating, learning. Nowadays it's good, webinar. Should have been, Anaga ma'am would have called, I don't know whether I would have got time to come and visit Pune. If I had done, I should have done. Now it is open, you have got opportunities to learn. Attend maximum webinars and try to learn. Ask more and more questions. It is an opportunity. That is the idea about work. Learn to work around the clock. Nowadays, everything at your fingertips, right? That is the idea about learn to work, right? I finished my presentations. You have got any questions? Most welcome. I love to answer the questions, whatever you want. Thank you, the organizers, for giving the opportunities. I appreciate the etiquette of all the participants who listened patiently me to around 55 minutes precisely, I believe, or 60 minutes or little more. Thanks for opportunities, and thank you one and all. Open for the discussion. Thank you.
Thank you so much, sir. It was a great learning. Thank you.
Thank you. Thank you very much, sir. Thank you very much for your session, especially you explain what exactly the clerkship, internship, fellowship, what are the differences between all these. You also explain the students how to prepare themselves for this clerkship and internship, and very importantly, how to get experience to develop the further experience. Especially the do's and don'ts, what you mentioned is very important for the students. Dear students, now session is open for your questions. So those who have questions can raise the hand. Once you raise the hand, unmute yourself and ask the question. But before that, raise the hand. So I will ask the question. I will ask you to ask the question. Raise the hand. Those who have question, raise the hand.
Sir, actually, I would like to ask a question. You did mention about the externship. So does PCI allow the externship during the period of internship? Like, because in the medical field, usually like they allow something like 9 months of internship, and then 3 months of externship is usually allowed for a typical MBBS intern. So this kind of arrangement is possible for PharmD students?
Yes, ma'am. Even Pharmacy Council of India is also providing you for 3 months. They can do wherever they want, right? Okay. And they have given the opportunities where the students can do and learn and come. PC has got that provision. For 3 months, yes, they can go for recognized hospital or laboratories or anything else. Certainly they can go and do it.
Okay, for the students, if they have got a problem raising their hands, they can directly, I think, ask the questions, because I think on mobile it is not easily possible. So not, if anyone is interested, you can directly ask. You can unmute and you can ask. No issues. Someone is asking.
Hello.
Yes.
Yeah.
Yeah, sir, I'm Samruddhi. I'm from 5th year PharmD. Sir, I wanted to ask, like Madhur ma'am said, like Madhur ma'am asked, and you told that 3 months we can do outside. So can we do it abroad? Can we do it in abroad?
Yes, you can do in abroad. Yes.
So what is the procedure for the same? Do you know?
No, the procedure is if you can identify if anybody are there in the other countries and all those things, you should get an invitation. All the official procedures are there. You should write a letter to the principal. Principal will give that permission for you. You should get the attendance where you are going to work and get a certificate. That should be good enough. It's as simple as that.
Okay. Thank you, sir.
Welcome.
So just to add to her question, like, is anybody from KLE, any students of KLE who have engaged in the externships abroad? And if yes, then which countries usually allow that? Or which specific universities?
Right, ma'am. Usually what happens is we have got an MOU signed by the university with in the Western countries like University of Illinois, Chicago, right? Or in Philadelphia and all those things. That is a one way. It may not be possible for everyone to do those things. But usually it happens for 1:1 relation or 1:1 contacts. If I have got some relatives in US or Australia or Europe or anything else, they can shoot a mail or start developing where they can get in touch with them and they can do it. It's usually 1:1 relation as of now.
Okay, sir. So, but then your suggestion would be to have a MOU. I mean, because then it becomes completely formalized, right? So, if we sign up a MOU with one of the hospitals, maybe in some country, then it would be easier and more consistently we'll be able to send the students there.
Yes, ma'am. Then what happens is the things, as said, there are a lot of regulations comes in. Suppose if you talk about US, getting visa is very, very tough. It's very, very challenging. Whether you got MOU or anything else, they got their own sweet way of giving the visa, and so many things are there. Okay, this faculty exchange program and all those things are there. Yes, if you sign a formal MOU, it becomes more easy to get an invitation from there, and all those things will be there. It's always good. But many a time it becomes really, it is challenging to some extent. Yeah, it is very expensive also, but somewhere you should have to have that opportunities, or else best way 1:1 students have relatives, friends or anything. Yes, from there we can build some contacts or relations or anything else, and then they can enter into those things. That is one way. Other way, what I tell my colleagues in my department, the best way is to look for an international conference or workshops. But that is a secondary objective. The primary is that suppose if I am going to Australia to attend a conference, I'll get a visitor pass, a visitor visa. Am I right? Yes, one way is to get entries to the conference. Meanwhile, you should do the homework saying that, okay, for 1 week, can I visit a hospital? During 1 week with my friends, can I visit a community pharmacy? Is that clear? So thus type things can be done for a short-term exposure or the observerships and all those things. Precisely, that's what I did one time when there was FIP was there in Melbourne. Okay, I went as a visitor visa there. Then I got some colleagues over there or friends or alumni or anything else. I expressed saying that I'm not going to do anything else. Just I want to see the hospital. That's all. Right. I got one of my alumni. I said that I want to spend 2 or 3 hours in your community. He runs a community. This is how we can build a relation or the opportunities, and then we can work all those things.
Yeah. Okay. Yeah. Thanks, sir. I think Kimaya wanted to ask a question. Kimaya, you can just unmute yourself and ask the question.
Okay, till the time she asks, I have got one question, sir.
Yes, please.
Sir, when we ask the students to go for this clerkship and everything, now we are having a tie-up with Aditya Birla Hospital for us. They will be going by rotation or something like that. But if we have got another hospital which is also ready to collaborate with us, so can such type of sharing be done, that few students in one hospital and few students in another hospital?
I don't think PCI will not permit you, sir.
Okay. Okay.
PCI
Right.
doesn't
So we
allow
have
it.
to have the clerkship in the hospital where we are having the collaboration, right?
Yes.
Okay. Okay.
And sir, same thing with the projects as well, right? So
Yeah,
the 50th
because
projects that it.
yes, because what council says that they have inspected the facilities and they are saying that it is good enough to train your students.
Right, sir. Right. Right.
Okay.
Okay. Yeah.
But finally, you can take a call in the interest of the students. This is off the record.
Yeah,
Right.
off the record we can manage. Yeah. Yeah.
I'm not telling to manage or anything else. If somebody comes there for a BAB facilities are there, really it is good.
Okay.
Right. You can send for that particular duration, not all 6 months outside the hospital. No, it's not acceptable. You can do more and more observership and all those things, but PCI doesn't allow you to do all those things. You should have to work in a recognized hospital only.
Okay, sir. Thank you, sir. Thank you.
So
Hello,
I think
sir.
Kimaya is
it's
not.
Kimaya Khare.
Yeah,
Yeah,
great,
yeah.
great.
Ma'am, I was having a network problem, so I was in the chat box. So my question is there any opportunity in the government sector to work as clinical pharmacist?
Very good question. I appreciate. May I know your name?
Kimaya Kale. I'm from 5th year PharmD.
Very good. Nice question. I think this, see, the only problem with my students across country is that they're very shy to ask the question. Arya, you can ask any question saying that can a PharmD can become a Prime Minister of India? Who stops you? Anybody going to hang you in your country? Huh? You know, such an interactive session we are arranged. People, they're drawing the courage to ask, मेरे को job मिलेगा क्या नहीं मिलेगा. Anyway, I appreciate the girl and I really congratulate the girl who is asking that question. Can I get a job in a government or can I get a job in any organization? My question is both yes as well as no. The question, I'll split it why it is yes and why it is no. When I say it is yes, right? You should explore your strengths and weaknesses, or you should concentrate your opportunities and see where can I fit into those things. For to do that, every day you should have to visit the websites, try to understand their philosophy of that website. For example, ICMR gives a lot of opportunities, right? A lot of clinical trial industries are there, a lot of government organizations are there. Look what they expect. If your expertise, skills, and all those things suits into those things, certainly yes, you'll get a job. I said another part. I said no. Why I said no is that, as I said in my all my presentation, you should have to say that, am I capable to do that? What is my expectations? Have I got sufficient knowledge? Have I got sufficient skills? Have I got my sufficient knowledge? If you got answer yes for all those things, you will get an opportunity. Otherwise, you will not get an opportunity. Simple layman example I'll give you. Of course, now I got little administrative responsibilities and all those things. Simple thing, I'll say that I want an accountant in my office. I'll get 105 applications. When we call them, chalo theek hai, I'm not disrespecting that course or anything else. I say that yes sir, I've done my graduation in accountancy or anything in one of the best college. I'll ask, do you know how to use the softwares like Tally or anything else? They say yes sir. I'll ask them, can you use it? Then they start narrow downing. And if you at the end of the session ask that, do you have skills? No sir, I don't have skills. Then who's going to give a job? Precisely that's what I'm telling in internship, you should develop a skills. You should earn your skills. How to earn the skills? By working. How to emphasize your skill? By working. Work for 2 years, then you'll get a skill, then you'll get a job. Right? Government do have that, but there is nothing like typical jobs for PharmD. ऐसा नहीं मिलेगा आपको. Is that clear? There will be opportunities and you should have to explore and then try to excel into those things. Hope I answered your questions.
Yes, thank you, sir.
Thank you.
Shorya.
Good afternoon, sir. I'm Aishwarya, a fourth-year PharmD student. Sir, I wanted to ask if any university in India provides PGY1 course for PharmD students.
Can you repeat my last sentence?
If any university in India provides PGY1 residency program for PharmD students.
PG?
Y1.
What is that Y1?
Year 1.
You mean that internship or residency?
1 year postgraduate course. Is there any postgraduate 1 year course in India?
Oh,
What she
okay.
Specialize into infectious diseases or oncology.
Fine. This is another very good question, right? I said, and I think you followed my example of surgery, a surgeon doing all those things. There is nothing like open invitation to any of these. They're very high order professions what you have chosen. They're highly intellectual PharmD students are expected. For all those things, you'll not get an open advertisement saying that मेरे को एक pharmacist चाहिए. ऐसा नहीं होता है. See, you should have to understand and see the websites and go and that's the reason this such you should express. Is that clear? If there'll be no open, as I said, an example of the surgeon, you should understand who is doing what. Go and meet them, express. Then there, for example, again, I'm not marketing, don't take in the other way around here. In my college, we have got a strength of clinical trials and clinical research. Fine. I am running a fellowship of 6 months, fellowships and or residentships in the clinical trials and clinical research. Okay. So I have put an advertisement on my website. But you should have to, there 1 year, 6 months is all left to you. It is a self-direct. You should volunteer what you want. Is that clear? Suppose if you want to volunteer, you should write a mail, go there, take an appointment, express what you want. Maybe Aditya Birla Hospital, maybe Kokilaben, maybe anywhere. You should have to drive your own road. There's nothing like ready-made road for all of you, because it's a very high order profession, high order degrees, and you should have to tell what you want. Is that clear? Suppose if you want to work in a pediatric unit, you should understand which is the best, where they're doing the pharmaceutical care services. Go, meet them, talk to them, express them. I'm sure in the country, in our Indian culture, if somebody who comes to my door to learn something else, I'm sure nobody will say no to you. But there are no structured courses, but they're there. A lot of institutions have started, a lot of organizations have started, but people are not taking because they don't do proper homework. Right? This is my 6 months fellowship program. And it all depends what, if you want to make a career in clinical trials or clinical research, I got 6 months, right? We are charging 40,000 rupees as a fees for 6 months. Out of that, I'll give 5,000 rupees stipend back to you. Means I'm giving 30,000 back. Only I'm charging 10,000 rupees for the fellowships in clinical trials or clinical research. Similarly, it all depends upon the need based. Similarly, we are going to start in the total parental nutrition fellowships. I'm starting the fellowships in reconstitution of cytotoxic drugs. It is there. If I know your interest, then I can guide you. Having pulled the courage to ask the question, can I ask the question for you? What is your area of interest to do 1 year fellowship or training or anything else? What is your area of interest?
Sir, actually, I was quite interested in critical care medicines or infectious disease medicine.
Fine. For that, you should search that infectious disease, who are the national institutes in our country. Right. I think there's one in Pune only, no?
Yes, sir.
National Institute of Virology.
Yeah, National Institute of Virology is there. Yes.
My dear student, have you visited that website till now? Ek bar to. Don't get shy to say yes or no.
No, sir, I haven't visited the website.
Yes.
Sir, actually, I was surfing through online. So like I could see many medical colleges which were offering residency programs, but then the eligibility criteria in that was only MBBS, not PharmD. Hence, I asked this question.
That's what I'm telling. You can visit the colleges once and explain that that's what I'm telling. No, they're called as a regulated courses are there. There you may not be available, but there are professional courses are there. Certainly you will be eligible, but they don't know who is PharmD, what is your background. You can go and take appointment, explain them. I'm sure certainly you should be able to get into those things. If not, also you can put a mail or anything else. I can assist you to fulfill your dreams or fulfill your questions. Right?
Yes, sir. Thank you so much, sir.
Most welcome.
Mani want to ask a question. Mani, are you there? Mani?
Yes, please go ahead.
Yeah. Mani, are you there? You want to ask a question?
Actually, she has put up her question.
Yes,
That
please.
during the internship, can we get exposure and experience in the clinical trial department? Clinical trial has lot of privacy policies regarding the patient's information. So is it possible during the internship to get exposure and experience in the clinical trial department? Is what she has asked, sir.
Yes, nice question. Definitely it is. See, what happens is here in internship, whatever is the prevailing facilities are there, where you have been admitted as a student or anything else. That's the reason I'm telling you, after PharmD, in the fellowship program, what we have done it, you should be a graduate, you should complete, then only we are allowing you to work. Exactly, a student has got good intellectual thinking, highly confidentiality will be there, all the control documents will be there. As a student, you are not allowed to do all those things. Only after completion of all those things, you have been permitted to do the things. And many times what happens, whenever they're student, they want to do everything. Only you get an exposure. After PharmD, you should have to pick up such fellowship programs or postgraduate programs to consolidate your interests. My straight answer for your questions, as a student, yes, it is no, you can't do it. But yes, after those things, you can get an opportunity to work in a clinical trial facilities, and that time you can get an opportunity. Hope I answered their question.
Yeah,
Yes,
thank you.
sir.
Thank you, sir. Thank you, sir.
So I think we have dealt with all the questions now. I mean, whatever was there in the chat box, it's all been answered. Sir, thanks a lot for a wonderful session, and it was straight from the heart. I mean, we could understand that the talk was straight from the heart, and the kind of
Very
things that,
passionate also.
one might feel that these were very basic things that were told, but I think this needs to be definitely pondered upon, and students have to really take into consideration all these basic things when they are going to start their fifth year clerkship as well as 6th year internship. So thanks a lot, sir.
Thank you,
Yes,
ma'am.
sir.
Thank
It was
you.
Thank you very much,
very
sir.
informative. And yes, like our association will continue further also with your permission, of course. And we look forward for many more such sessions.
Yeah, anytime. Most welcome. We are open for all those things.
And
Yeah.
also,
you
sir,
so
we
much.
will like to come and visit your department once, so as that it will add to our learning as a team of faculty members.
Most welcome. I'm ready to host you at any time. You can just walk down without any, just 24 hours notice should be good enough for me to make all the facilities. No, absolutely no problem.
Great, sir. Great. Thank
you
you
so
so
much.
much.
Thanks a lot.
Thank you,
Thank
sir.
you. Thank you so much.
Thank you. Thank you.
Thank you.
Bye-bye.
Yes.
Bye.